Hi, my name's Lorraine Rosati, and I'm the Associate Director for Mental Health and Learning Disabilities in the CCG. I joined the NHS in 2008, and I joined as a temp commissioning offender health for Brixton Prison in Lambeth. I went for 3 months and stayed 5 years. I've worked in a number of NHS commissioning roles in local government and in central government. I've also been a parliamentary researcher. I've worked in an online poker company in Gibraltar, and I even spent 9 months as Director of Global Health at the Royal College of Obstetricians and Gynecologists. And I bring all of that experience with me to BLMK. I joined Luton CCG in September 2016, and here I am. I usually start by checking emails that have come in since I clocked off the previous day. I check for any emails about patients and make sure those are actioned quickly by a member of my team. My team oversees commissioning for people with complex mental health needs, learning disabilities and autism, which needs a lot of coordination across health and social care. So it's not all about me. I work with caring and dedicated people in my team who work hard to support patient care for some of the most vulnerable people in our communities. I may have a meeting about a patient's care that involves the CCG as the health commissioner, a local authority as the social care commissioner, and a mental health trust to work through how we can best support a person into the right care for their needs. And because some people have very challenging behaviour, it can be really difficult to find the right support. Quite a lot of my work involves planning, finance, and ensuring that BLMK is meeting the expectations of the NHS long-term plan. The pandemic has led to a big increase in the number of people needing mental health support, so you can imagine that it's a challenge to manage that while also developing new ways of working. We have a number of important projects that involve changing how we support people's mental health in BLMK. The biggest by far involves transforming how community mental health is provided. It's a sea change in how people will be supported closer to home and involves what we call a co-production approach to designing and delivering change. People with lived experience, carers, frontline staff, commissioners, and the voluntary and community sector are working together to make those changes. Members of my team are working within that co-production approach to develop the local offer for people. We also have collaborative working around crisis care, eating disorder services, and the development of a new inpatient unit in Bedford. We've been working for several years on a co-production approach in Luton called Reimagining Mental Health, and they're currently working on a mental health strategy for Luton. Another area of work that has involved the integration of mental health and primary care is health checks for people with severe mental health needs. Every GP practice and both of our mental health trusts are providing health checks that are aimed at improving the physical health of people with severe mental illness. The pandemic has affected GPs' ability to carry out those checks, but we're working with practices and local organisations to really increase the number of people who had their check this year. And that includes using new technology to carry out checks in people's homes. We have 3 providers in Bedfordshire, Luton and Milton Keynes, and they've developed a series of one-off webinars for people that can be accessed over the internet. It's a great example of how by working together, service providers can develop really good ideas and learn from each other to benefit patients. The Talking Therapies collaboration shows what can be done when people work together for the benefit of patients. It doesn't matter where people live, they can access webinars about a range of issues provided by one of our 3 providers. They're adding new webinars and expanding the offer all the time, and people can choose a time and date that suits them. But we can always do better, and that's something that will really benefit people with mental health needs, learning disabilities and autism. We need to develop services with them. If you want a rewarding career in an area of health that helps some of the most vulnerable people in our communities, then look at mental health. There's a huge range of diverse opportunities available. The investment in mental health now and in the next few years will mean we need a lot more workers across the NHS and in the voluntary and community sector. I won't pretend it's not challenging. there are easier areas of health to work in. But what gets me out of bed in the morning is knowing that that challenge is worth it.